Not all birth defects are preventable, but there are things a woman can do in order to increase the chances of having a healthy baby. The Centers for Disease Control has challenged all women to make a pact or commitment to themselves to do whatever they can to get healthy before trying to get pregnant. PACT is an acronym to help us remember what we can do. P is for plan ahead, A is avoid harmful substances, C is choose a healthy lifestyle, and T is talk with your doctor. Let's start with P, or planning ahead. One of the first things you can do is start today by taking a prenatal vitamin, one that has at least 400 micrograms of folic acid in it. And what this does is ensure that there's enough folic acid in your system when you actually get pregnant, and it will reduce the chances of your baby having spina bifida. There are different germ layers that are forming in the first couple of weeks after conception before you even know you're pregnant. And if there's not enough folic acid, that's when this can happen. So you need to plan ahead and take a prenatal vitamin even before you start trying to conceive. A is for avoiding harmful substances. Avoid alcohol, smoking, illicit street drugs, and even think twice about prescription medications, over-the-counter medications, and herbal supplements. There is no safe amount of alcohol at any time during pregnancy, so just avoid it altogether. And if you're trying to get pregnant, stop drinking before you even start the process. If you do drink during pregnancy, then it increases the chances of your baby having a host of complications that can last a lifetime for them. These are called fetal alcohol spectrum disorders. As for smoking, it increases the chances of complications during pregnancy, like preterm labor, preterm delivery, placenta previa, placental abruption. And then some women think that, oh, I've done great, I didn't smoke while I was pregnant, but then they start again after the baby's born, and secondhand smoke can also be deadly to a baby and increases the chances of sudden infant death syndrome, also known as SIDS. If your own health isn't a good enough reason to quit, then let your baby's health be a good motivation to stop smoking, and it's never too late. Because of common sense, most people figure that it's smart to stay away from illicit street drugs during pregnancy and really at any time in life. But some people do question the use of marijuana and think that it might help with like nausea early in pregnancy or other discomforts that you feel during pregnancy, but it too is not safe and has been linked to developmental problems as the child gets older. Lower IQ, attention deficit disorder, so stay away from marijuana too. If you've been on any prescription medication or are thinking about taking over-the-counter pills or herbal supplements, talk with your OB provider first to make sure that they're safe during pregnancy. C stands for choose a healthy lifestyle. Talk with your doctor before you get pregnant. Make a preconception appointment, and they'll discuss your health history and decide if anything needs to get in control before you get pregnant. A couple of health conditions they'll talk to you about or consider are obesity, high blood pressure, thyroid problems, and diabetes. If these things are not well controlled, then it can increase the chances of pregnancy complications and birth defects. And lastly, T stands for talk with your healthcare provider. They're always going to be your best resource because they have a knowledge of your circumstances and can give you the best advice if you have questions and tailor it to your needs. But they'll also talk with you at your first few prenatal appointments specifically about past infections, things that might pose a risk to you during pregnancy, like sexually transmitted infections, hepatitis. Take toxoplasmosis, for example. This is a parasite that you can get from changing cat litter. So this is important for a pregnant woman to know because it can affect your growing baby. If you have a cat at home and you're trying to conceive, then happily you'll be able to pass that duty off to your partner until after you've had the baby. They'll also talk with you about immunizations that you should get during pregnancy, one of which is the flu shot, and another important one is the Tdap booster shot. It stands for tetanus, diphtheria, and pertussis. And pertussis is the whooping cough piece. And babies are left vulnerable. They can get whooping cough during the first year of life because they can't get their own immunization until around their first birthday. So the mother is given a Tdap booster shot after 27 weeks. And as her body builds up extra immunity, it's passed to the baby through the placenta, and that's what offers them protection until their first birthday. Pregnancy is a really exciting time, but it can also be super stressful. By doing these things, you'll at least have some peace of mind knowing that you did everything you could to make sure that your baby is as healthy as possible. If you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms and recommend us to your friends and family too.